SAS doctors are the largest workforce in the emergency departments in the country. So we make up the biggest membership of the college. And for us to now finally have voting rights as well by being able to be members by election, I think that there's further opportunities to make things better and to really involve and include MSAS membership. There's just so much about SAS doctors. It's difficult to answer that question in a short sentence or even a short paragraph. They're so diverse, not just in who they are, but what they do, what their passions are. I've met SAS doctors who are professional sportsmen and sportswomen. Um, I've met people who've got careers outside of medicine, careers outside the emergency department. We're trainers, we're educators, but what we do is we stick around in one place. We're loyal to our departments. We make our departments the place that they are. So the trainees come and rotate through us, but it's us and our consultant colleagues and our ACP colleagues who actually define that department. And in that department, I've often seen SAS members who've put together have more clinical experience than the consultants that they work with. So that really excites me a lot. Um, a lot excites me about the career or the options that I've chosen to get involved in. My table tennis umpiring, for example. Now, I may not have had that opportunity if I was in training. I know I wouldn't have. But as a consultant as well, it can be challenging. So yeah, that's what excites me the most. Something we started off when Steve was chair and when I was West Midlands representative was that we started to reach out to every trust and ask them to have an MSAS representative for that trust, um, in addition to the regional reps we have, so that we can sort of build a trickle down network that can send information and feed information into SAS doctors, but also feed information back to us if people raise concerns. My email address at the college is available to all SAS doctors if they have concerns to email. It's msas@rcem.ac.uk. I try my best to get personally involved in people when they approach me, so it's not just a business transaction. I try my best to give people time when they bring a problem to me and to offer a solution as long as it's within my remit to offer that. So that's one thing I'd like to do. Another thing I'm thinking of is every 3 or 4 months to send out some kind of communication to the MSAS members that are part of the college membership that engages them. It might just be a simple poll for something because I'd like to get their opinions on things. But I think every time we reach out, people will respond. And it might be a different group of people every time. I'm also quite keen to have a regular spot on the college newsletter and the supplement that goes out with EMJ. We've always encouraged MSAS doctors to contribute to it, and I look forward to sending my first contribution to it as well. I'm really excited to reach more of our members. I want to expand the MSAS membership. I'd like to get them to see that the college has a lot more to offer to them than maybe just a conference or the opportunity to be an examiner or a supervisor. So we had a really important question that's come in from to the communications email address that you had tweeted, the college had tweeted. And that was about the BMA ballot that I think closes on the 18th of December for SAS doctors around pay rises and industrial action. Now, as a college, I know we're not a union and we wouldn't support any one direction. But what we can say as a college and as MSAS is it is your vote, it is your chance to get your voice heard. And if less than 50% of BMA members who are SAS doctors vote, then then an action cannot be taken. So with the government looking to limit industrial action and junior doctors and consultants already having voted for industrial action, this might be your only opportunity to make a decision or to be part of that conversation about a pay rise for SAS doctors. So if you are an MSAS member, if you're an SAS doctor working in emergency medicine, and you're a member of the BMA, please vote. Whatever your vote is important, so please cast it. As a final word, I would also appeal to all MSAS members to say, if you are interested in being an executive on one of our committees at the college and represent MSAS, or if you'd like to be an MSAS representative for your region or even for your trust, please get in touch with us. We would love to have you on board. I think MSAS has been very fortunate, and we've been very blessed that is a small core group of very dedicated individuals who give of their time to make sure that SAS voices are heard. But we'd like everybody to be involved, and we'd like everybody's voice to be equally important. So if you feel that you would like to give this a try, there are opportunities on the MSAS website. There are opportunities at the college website for vacancies on different councils and different committees. Please, please get in touch, and we'll do our best to help you represent other SAS doctors.